the CEO and founder of CureBionics. We are a medtech/robotics company that develops the next generation of accessible bionic prosthetics for people with limb differences.
I have a startup called Innovative Health Solutions, which created an app called L to help women and girls have access to accurate health information and connect them to health workers.
I'm a public health specialist as well as a digital health expert with a focus in gender equality as well as youth engagement.
I'm interested in building innovative solutions in the space of healthcare, leadership and education. So what we actually bring to Africa is increasing opportunities for young people who want to build solutions in healthcare. We offer training in the areas of cloud computing, DevOps, data science, machine learning, artificial intelligence, advanced training courses.
I was a founder in Ethiopia and in Rwanda. I founded startups in different healthcare sectors, including sexual reproductive health and non-communicable disease.
I'm not an engineer, so I design the solutions, but on the technology, there are sometimes some features that I would like to have that are a bit difficult to have with some engineers in my country, and that's one of the great challenges.
So some of the common challenges for hardware companies are access to funding and regulatory compliance.
Funding is not the only problem that we are facing in regards to resources. We also have a lack in talent pool. And even though there are a lot of talented, skilled young people in Africa, it's still hard to reach them and to work with them within the infrastructure that we have.
Our first challenge is to do with gender equality, the gender representation in the healthcare system. Having known that 70% of the healthcare frontline are women. However, when it comes to leadership representation, we have less than 5%. The Youth in Digital Health Network is actually a platform that is going to help me amplify my voice as well as advocate for those that can actually not speak for themselves.
I believe that the Youth in Digital Health Network already has access to existing platforms that have these solutions that we are looking for. So instead of us trying to reinvent the wheel, we can connect to the Youth in Digital Health Network.
The connections with the right stakeholders and organizations, and why not governments, to adopt our solution and to help us overcome these challenges, help us expand in other African countries by helping us, let's say, understand and overcome the regulatory barriers.
Advocacy for the regulation so that an innovation from a country could be exported to another and be used.
It's important for us as African innovators to connect with each other. And you get to learn the landscape of the business, you get to learn about the ecosystem of digital health in different countries. Those are the best parts. And I think with us building those networks together, and we can unify our voices and be heard louder.
I think the network is an exposure, firstly for peer-to-peer experience sharing, because I learned a lot also from what is doing in other parts of the regions and how it could improve what I'm doing.
What could be working for me in Zambia, maybe it could be useful in Nigeria or Tanzania.
I get to learn from those who have gone ahead of me, the challenges they face, how they were able to overcome it. Other individuals like myself who are looking forward to building innovative solutions, either in EdTech or in MedTech, we are also able to leverage from those networks and not have to go through some of the hurdles and challenges that our predecessors went through.
I also think the network would bring exposure in terms of venture capitals, in terms of funding opportunities, in terms of capacity building.
We are in an era of collaboration, not competition now. So I guess by getting in touch with the right stakeholders and more stakeholders, we will have more chances to succeed and to empower the continent.
I'm really excited to see how this network really helps all of us succeed and all of us work together. And it will create platforms for us, not to just work together and scale in different countries, but it can help us really innovate for the continent.
This is a testament of the fact that the network is looking out for people who are doing great work in the community. It's an encouragement for me to continue the work I am already doing, and also an encouragement for more young people who are maybe shy to take the challenge, to go out there, push themselves, to say that, hey, if it was possible for Dr. Samba, then it could also be possible for me. And he cannot do it alone. It's by that collaborative effort for us to come together to see how we can make our Africa ecosystem a better place and the world in general a better place.